Here is the leg. Leg is located between the knee joint and ankle joint. It has two bones. Here is the tibia. You can see on the medial side, big bones, the tibia. On the lateral side, you have fibula. You cannot see very well. It's deep to the muscles. And we have two compartments, anterior compartment and also posterior compartment. Here is the anterior compartment, here is the posterior compartment. We also have a small lateral compartment. You see here is the small lateral compartment muscles. So I'm going to start by having a look at the anterior compartment muscles. Here is the anterior compartment muscles. We have actually four muscles here. First of all, I will show you this one. Here is the Tibialis Anterior. It attaches to the tibia. Here is the tibia, medial surface of the tibia, and the shin or anterior border of the tibia. On the lateral surface, we have Tibialis Anterior. And as you see, its tendon comes down and attaches to the base of the first metatarsus and medial cuneiform, these two bones. And next to the Tibialis Anterior, we have Extensor Digitorum. You see it's going to the digit, and its function is extension of the digit or toes. That's why it's called Extensor Digitorum. It's coming from the fibula, and its tendon goes to the middle and distal phalanges of the four toes except the big toe. Between the Tibialis Anterior and Extensor Digitorum, we have Extensor Hallucis Longus. It is deep to these two muscles, and you cannot see very well the muscle belly, but you can see the tendon of the Extensor Hallucis Longus. It attaches to the distal phalanges, distal flanks of the big toe. And we also have a small muscle here. It's part of the Extensor Digitorum. It is called Fibularis Tertius. We have two fibularis in the lateral compartment. The third one is here as a part of the Extensor Digitorum, Fibularis Tertius. It's not going to the toes. Its tendon, as you see here, attaches to the fifth metatarsus. Attaches to the fifth metatarsus. So in about 9, in the anterior compartment of the leg, we have four muscles: Tibialis Anterior, Extensor Digitorum, Extensor Hallucis, the deepest one, and we also have Extensor Hallucis Longus, and we also have Fibularis Tertius. So what is the function of these four muscles? As you see, all these muscles, tendons of these muscles, crosses the ankle joint anteriorly. So they can do dorsiflexion. Imagine that here's the foot. They can do dorsiflexion of the ankle joint. But as you see, the Extensor Digitorum tendons attaches to the distal end of the toes, so they can do extension of the toes. Extensor Digitorum, extension of the toes. Extensor Hallucis Longus, extend the big toe. And what about the Tibialis Anterior? Tibialis Anterior, as you see, it attaches to the base of the first metatarsus and medial cuneiform. So it attaches to the medial side of the, or medial border of the foot. So it can do inversion. The plantar surface of the foot faces medially, so it can do inversion of the foot. What about the Fibularis Tertius? As you see, it attaches to the fifth metatarsus, and it can help these muscles, lateral compartment muscles, can do eversion. Like this, it is the inversion, eversion. I mean, the plantar surface of the foot faces laterally, it's eversion. And I will show you here. If you look at my foot, it is inversion. Tibialis Anterior can do eversion, but Fibularis Tertius can do eversion. This is eversion, and this is inversion and eversion. It's inversion inwards, eversion outwards. And here is the lateral compartment. We just have two muscles in the lateral compartment. They are attaching to the fibula. That's why they are called fibularis. One of them is long, the other one is short, so it is called Fibularis Longus, and the other one is Fibularis Brevis. So Fibularis Longus, it attaches to the upper 2/3 lateral surface of the shaft of the fibula, but the Fibularis Brevis attaches to the lower 1/3 of the lateral surface of the shaft of the fibula. And if you look at here, the Fibularis Brevis passes behind the lateral malleolus and attaches to this tuberosity, which is called tuberosity of the fifth metatarsal. Here is the fifth metatarsal. Here is the tuberosity of the fifth metatarsal. So it attaches here the tuberosity of the fifth metatarsal. But Fibularis longus, it is long. After passing behind the lateral malleolus, it crosses the plantar surface of the foot, and its tendon attaches here. It attaches to the base of the first metatarsal and medial cuneiform. As I showed you before, Tibialis Anterior also attaches here, and tibia and this Fibularis longus, after crossing the sole of the foot, it attaches to the base of the first metatarsal and medial cuneiform. What is the action of these muscles? As you see, they are crossing the ankle joint posteriorly because they are passing behind the lateral malleolus. So they are crossing the ankle joint posteriorly. So they can do plantar flexion. Here is the dorsiflexion. Here is the dorsiflexion, plantar flexion. They can do plantar flexion, but it's not their main action. Their main action is eversion. So Fibularis longus and Fibularis brevis, also Fibularis tertius, these three muscles can do eversion, but Tibialis anterior can do inversion of the foot.